Asthma is one of the most prevalent long-term health conditions for children and young people, and there are around 1 to 3 children in every class who have asthma. All children with a long-term health condition should be considered for an individual healthcare plan, and that is a written set of instructions on how to look after a child in day-to-day, provide medication and what to do in the event of an emergency. So children with asthma should have a slightly different type of individual healthcare plan called a Personal Asthma Action Plan, or a PAP. And that PAP just tells anyone who is looking after that child and the child themselves what they should do if they feel unwell, and what they should do in the event of an emergency, and who they should contact if they need help.
I was given this, which kind of helps me, myself. It's an action plan from the asthma nurse, so I always try to give a copy to school as well, just for them to be confident enough to know the amount that he needs and the way to go about it, so everything can be fine afterwards. So this really helps me, and they have one in school, so it helps them also to know what exactly they're doing for him.
Currently, if a child doesn't have a personal asthma action plan in school, they're left without any advice. There isn't any support on what to do. The idea with the whole school asthma approach is that schools are able to follow a set of instructions on how to look after that child, even if they don't have a personal asthma action plan. So the school asthma action plan would support all children in that school environment or nursery environment who have asthma.
It's very important for the school to know exactly how to administer the medication for it to work.
To be eligible for the whole school asthma approach, a school must have an asthma policy, an asthma register of all children and young people with diagnosed asthma, an emergency asthma and allergy kit and procedures for use and ongoing management, consent from parent and carer of all children and young people with asthma to use the emergency inhaler, a system for recording the use of medication and flagging excessive usage, so for instance more than 3 times in a week, in the space of a week, and we would also ask you to consider the home environment, a system for identifying and referring children and young people who are absent from school due to asthma or unable to partake in PE or have had an A&E admission due to asthma. We need to have an asthma lead and other key staff trained in the management of asthma and allergies, and 85% of school staff trained in asthma awareness. The whole school asthma poster is a step-by-step guide on what to do when a child is unwell and how to escalate that if a child goes on to have an asthma attack, and how also to step that down. It also has guidance on how to use a spacer and the steps that you take. So what the whole school asthma action plan has on it is that information, all of the information that a school needs to know in the school day. Those steps are the same for every child. So every child who has a wheeze, shortness of breath, has a cough, you do this. Every child who's displaying symptoms of an asthma attack, you do that. So we've spoken to children, we've spoken to families, we've had really great feedback from them. We've shown them the poster, they love the concept, they love the idea, and they love that it makes them feel safe to send their children and their young people into schools. It's about working smarter and not harder to ensure that all children have access to information to support them in the event of an emergency or if they're feeling unwell, into creating a school environment where everyone knows what asthma is, everyone knows what to do, and everyone can provide that support in real time.